2014 Stage 2 training. During today's training session, we'll be going over all of the measures that have been introduced for Stage 2 of meaningful use. So to kind of walk you through all of those measures for Stage 2, we'll be working off of the provider dashboard in OfficeEMR, which all of you should be familiar with, and you had used for Stage 1. We'll be working off of that same dashboard for Stage 2, and for that, we'll kind of walk you through all of those different measures, explain what's new, what's different from 2013 and years past for Stage 1 of meaningful use, and basically kind of get you up to speed on everything you need to know to begin your Stage 2 meaningful use reporting. Into the reports section of the application, and then we'll go ahead and actually pull up the provider dashboard, and I'll kind of walk through how you actually go about adding yourself as a new provider to the dashboard for Stage 2, and then we'll kind of start walking through all of our different measures. Okay, so I'll go ahead and click on the reports button here in the lower left-hand corner once, and then on our left-hand side of the screen there, we have all of your different options here within the reports. We'll just scroll on down towards the very bottom of that list and click once here on Provider Dashboard to pull up our new dashboard for 2014 Meaningful Use. Okay, so as you can see there along the bottom, we've kind of flipped things around a little bit, so all of the provider names are now listed at the very bottom, and your dashboard will now be on top. Okay, so as you can see, we've already got quite a few different providers that have already been added to our dashboard. But just to kind of walk everybody through the process of adding yourself or adding a new provider to the dashboard, I'll kind of walk you through that process here now. Okay. So when you're ready to add a new provider to the dashboard, all you need to do is first come over here and click on your new or add provider button. Okay. So click on that once, and then in the window that pops up here on the screen, towards the very top, you'll basically see a list of all of the providers that are currently set up in your database. Okay. So we'll just go ahead and say maybe we want to work with, we'll just use Christy George here. So we'll click on Christy's name once. That's the provider we want to use. And then once you've selected the provider, there's basically some additional options you'll want to fill in to set up your provider dashboard correctly. Okay. So the first thing you'll want to do is select what year you're actually beginning your reporting period, or what year you plan to attest for meaningful use during the current year. So it's 2014 this year. This is, we plan on actually doing our 90-day reporting period this year. So I'm going to go ahead and select 2014 as my year. And then here in the stage drop-down that's now just lit up for us, we'll go ahead and select ONC 2014 Stage 2. Okay. From here, we'll then want to select what programs. This is basically going to be whether you're attesting or qualify for either the Medicaid reimbursement program or the Medicare reimbursement program. We'll just go ahead and say Christy's going for Medicare, so we'll go ahead and select that. I'll come back and select Medicaid here in just a second, just to show you there is one kind of small difference between the two. So I'll go ahead and select Medicare here first, and then what you want to do after that is here in the period. For Medicare, they basically, CMS has said that if you are testing for the Medicare reimbursement program, the 90-day period that you need to kind of get in before the end of this year, you'll have to begin your 90-day period on a quarterly basis. So you have to either begin at the very beginning of the year for quarter 1 or start at quarter 2, 3, or 4. Okay. We'll go ahead and say that Christy's wanting to start here maybe at the very beginning of quarter 2 here at the beginning of April. So we'll select quarter 2 as our period, and it's going to automatically fill in your 90-day period in the start and end date boxes down here below. And then the last thing we'll just need to fill in here is what vital signs we would like to capture as a part of our meaningful use reporting period. Okay, so your options for your vital signs are either going to be to capture the patient's height, weight, and blood pressure, just their height and weight, or just the blood pressure. Okay, you may want to note that basically you do have the freedom to kind of choose whichever vital signs you feel best fit your scope of practice. So the decision is up to you. I imagine probably a lot of you will be choosing just go ahead and choose that height, weight, and blood pressure. So we'll go ahead and select that there for Christy. Okay. So at this point, I could absolutely kind of continue on and basically fully add Christy to the dashboard by just clicking the OK button, and then we would see her name appear here in the list at the bottom. Before I do that, I'm going to go back to that program selection here real quick, like I mentioned before, just to kind of point out the one difference between the Medicaid and Medicare, just so that everyone is aware. So if we go back here to the program drop-down box, and if I change this from Medicare to Medicaid, the one thing that basically changes is your period or your 90-day selection there. So if you select Medicaid, you'll basically have the option to choose whether you're testing or going to report for a 90-day period or for a full year. And for 2014, regardless of what stage of meaningful use you're in or what year you're on, everyone in 2014 only has to do a 90-day period. So in 2014, whether you do a Medicaid or Medicare, you'll just select a period of 90 days. So I'll go ahead and select 90 there for Medicaid. And then the one difference between Medicaid and Medicare, as I mentioned, is on the reporting period. If you are doing Medicaid, you have the ability to choose when you want your start date to be. So that can literally be any date on the calendar year, so long as you get a full 90 days in before December 31st. Okay? So Medicaid, you have the ability to pick and choose what you want your start date to be. On Medicare, you have to start on the very beginning of one of the 4 quarters of the year. Okay? So that is the difference between the two. And I'll just go ahead and, just to make things a little bit simpler for us, we'll just switch Christy back to Medicare, make her period Q2, and now we'll go ahead and click the OK button now to fully add Christy to the provider dashboard. So now that I've hit OK, we can see that Christy's name here is now listed in a list of providers. So then to basically, once you have your provider added to the list on the dashboard, to actually pull up that provider's dashboard and see how they're doing in terms of meeting all the different measures, you just want to click once on that provider's name. And at that point, up top on our screen, we now see all of those different red and green buttons that you're used to seeing for stage 1. We now see those up top at the very top of the screen. We'll go ahead and start off with our core set of measures here. So everything up top in the upper portion of our screen, these are all of our core measures for stage 2 of meaningful use. So again, just to kind of remind you what the core measures basically means is any measures you see listed there in that core section up top, all of those measures need to be lit up in green, or you need to be meeting those measures in order to be able to successfully attest for meaningful use stage 2. And then down on the lower portion of our provider dashboard, we have the menu set of objectives. And those are basically now 4 additional measures that you have the ability to meet. And for the menu set, it works pretty similar to how it was for stage 1, where you don't have to meet all of those. And for stage 2 on the menu set, you basically have to meet 3 of the 4 listed menu set objective measures there. Okay, so core measures up top, you have to meet all of those. On the menu set, you only need to meet 3 out of the 4 you see listed. Okay, so we'll start off with our core measures there. So in the upper left-hand corner, we'll go ahead and click once on our vitals objective and kind of take a look at what all is going on with that particular objective. I'll let you know what is different or changed from stage 1, and we'll talk about the threshold you need to meet and everything like that. Okay, so for the vitals objective for stage 2, it's essentially pretty similar to how it was for stage 1. There were, however, a few different sort of age changes that have been made from stage 1. Okay, so again, if you remember back to stage 1 of meaningful use, you basically had to make sure you captured the height, weight, and blood pressure for at least 80% of the patients that you basically had saw during the EHR reporting period. That basically holds true, but a few of the changes I'll let you kind of in on what has changed there. So for the height and weight that you measure for your patients, in stage 1 or in years past, so for 2011 through 2013, the height and weight only needed to be recorded for patients who were aged 2 years and older. For starting in 2014, they've actually changed that, so a height and weight will need to be recorded for all patients of all ages. So they don't care what age the patient is anymore, you need to be capturing that height and weight unless you feel a height and weight measurement is out of the scope of your practice. Okay. For the blood pressure requirement in years past, so through 2011 through 2013, the blood pressure needed to be recorded for all patients aged 2 and older. For 2014 now, they've changed that, so blood pressure needs to be recorded for all patients aged 3 and older. So they changed that from 2 and older up to 3 and older now for 2014. And again, you'll need to capture your blood pressure for all of those patients, or at least 80% of those patients, unless, of course, you feel that that blood pressure reading is out of the scope of your practice. The next objective we'll take a look at is the demographics objective. So again, we'll go ahead and click on the demographics button here on our dashboard to pull up the window that basically gives us an explanation of what this objective is and the threshold we need to meet. So the demographics objective, there's basically little difference from stage one to stage 2 of meaningful use. So you're still having to capture those 5 demographic fields, so the patient's preferred speaking language, gender, race, ethnicity, and date of birth. So those fields have not changed at all from stage 1 to stage 2, so those are still the exact same. The one thing that has changed, though, is for the percentage of the patients you have to capture this information for. So for stage 1, it was 50% of the patients you saw during the reporting period. For stage 2, you need to capture these fields for 80% of the patients you see during the reporting period. Okay? So that's the only change we had there for the demographics objective. Look at is the smoking status objective. So again, we'll go ahead and click on our smoking status button here to pull up our window, and we'll take a look at the information for this particular objective. So for the smoking status, basically the same situation that we had there for the demographics objective. So the smoking status objective, the only change we see here is basically the threshold or the percentage of the patients you need to capture the smoking status for. So for 2011 and years past, for stage 1 of meaningful use, you had to capture that smoking status for 50% of the patients you saw during the reporting period. For stage 2, you have to capture that smoking status for now 80% of the patients you see during the reporting period. So again, for most of you, that smoking status should be somewhere in the social history section of the history chart tab in the EMR. So it should basically be the same smoking status drop-down list you're used to seeing from there. And then again, you'll just want to make sure you're capturing that smoking status for at least 80% of the patients you see during the reporting period. The next objective we'll take a look at is the med reconciliation objective. So the first thing that's kind of different about this objective is it actually moved from the menu set up into our core set of measures there. And the next thing that's different, I'll go ahead and click on the objective so we can see all the information about it. So the next thing that's a little bit different from MedRec in stage 1 to MedRec of stage 2 is the way that the patients who get added to your denominator, the way that kind of works is a little bit different. So patients will only get added to the denominator for this objective if that patient is new or has been transitioned to your care, and along as a part of that kind of patient coming into your care, if they bring along with them or their previous provider sent over for them an electronic transition of care summary document. Okay, so basically the way it works with all of these certified EMRs is they have to be able to spit out a transition of care summary document. It's an electronic document that basically has the patient's codified list of medications, allergies, problems, and things like that. So whenever a patient leaves their care and goes somewhere else and, for example, comes under your care, what a patient should be able to do is bring that transition of care summary document with them. You'll be able to import that document then into that patient's medical record here in OfficeEMR, and from there you would then be able to kind of reconcile what medications that previous provider had in their system. You'll be able to kind of compare that to what you've got in the patient's chart in your system, and then kind of mesh the two together as you would like to. Okay, so that's kind of the end goal of this entire objective. And again, a patient will only fall into the denominator of this objective if they have basically brought over, or the doctor has sent over one of those transition of care summary documents. If a patient is brand new into your practice but does not have a transition of care summary document, that patient will not fall into the denominator here for this particular objective. Okay, so it'll be only for those patients who have that transition of care summary document. And then basically from here, the way it'll work is once you kind of receive that document, if you'd like to kind of import that into the system, you'll be able to do an OfficeEMR search and pull up the quick use guide that'll walk you through step by step how to do that. And then once that's been done, what you'll basically do in the patient's chart in the EMR to kind of reconcile that list is I'll kind of walk you through that here real quick. You'll just want to first go into the EMR, and then you'd want to open up that patient's chart. Okay, I'll do that here for just a test patient here. Okay, we'll use test Chris. So then whenever you first open that patient's chart, here right on the Summary Chart tab, what you'll want to do here is in the lower left-hand corner of the Timeline section, so if you kind of follow my mouse here down, you now have this reconciliation button that you want to click on, okay? So you just want to click on that button once. You'll get a patient reconciliation window that will automatically pull up here for you. And then from here in this window, you'll be able to see a list of what medications, allergies, and problems you currently already have in the patient's chart, what is basically on that transition of care summary, and then you'll be able to decide which options for their allergies, medications, and problems, which ones you'd like to kind of keep or import, and which ones you kind of want to ignore or not import, okay? And then once you've done all of that, you'd be able to kind of click Save here, and at that point, our system would either import any allergies, medications, or problems you decided to, or keep those allergies, medications, or problems that you decided to keep. We'll kind of add or keep those in there, or anything you didn't want to import or anything like that, we won't import into the patient's chart. Okay, so that's the button you'll now want to click on, where in the case if you do need to perform that med reconciliation for a patient, this is where you'll want to do it. Just right inside the patient's chart in the EMR, and on that summary here in the timeline, the lower left-hand corner, click on your button, do the reconciliation in that window that pops up, and then click Save. And then once you've done that, you will then basically have met the patient who will fill in kind of the denominator for that particular objective. Okay. So we'll go ahead and jump back to our dashboard here next, and we'll close out of the MedRec button there, and we'll kind of take a look at the next objective we have on the screen. Prescribe Objectives. So I'll go ahead and click on our Prescribe button to take a look at what we've got going on here. Okay. So for stage 2, there's actually kind of a combination here. The Prescribe Objective is now a combination of 2 old objectives from stage 1. So it's basically a combination of course, the original Prescribe Objective, and then they're also combining it with the RX Hub objective as well. So again, the RX Hub is a company setting that should be turned on automatically for the entire duration of the reporting period. So there's nothing special you need to worry about there for the RX Hub component of this measure. And then basically, again, for the Prescribe Objective, it's the same exact as it was last year, except you have to do it for more patients than for stage 1. So for stage 2, you basically just need to make sure that you are e-prescribing or electronically sending more than 50% now of all prescriptions that you write for your patients. Last year, or in years past for stage 1, it was 40%. So it's kind of up that from 40 to 50%. And basically, as long as you're e-prescribing more than 50% of all prescriptions that you write, you'll be able to meet this objective. The next objective we have there is the Decision Support Objective. So we'll go ahead and click on that button there to pull this up. So basically for Decision Support for Stage 2, it's pretty much the same as it was for last year, except you'll now be required, instead of setting up just one Decision Support rule in the system, you'll now have to set up basically 5 different rules within the system. Okay. Fortunately for you, we at iSalus Healthcare, we're actually going to automatically set up 5 decision support rules based on clinical quality measures that we've been certified to kind of keep track of in the system. We'll basically set up 5 decision support rules based off of those 5 clinical quality measures, and we'll get that all set up for you, and those should fit across a wide range of different specialties for you automatically. So we'll kind of take care of basically getting that all done for you. Okay. One thing I'll point out here on the decision support objective is there actually is 2 different sort of components that make up this one decision support objective. So here in the upper left-hand corner of the window, you can see here we have tab 1 and tab number 2. Tab 1 is basically what I just described. So this is the required requirement that you basically have to set up those 5 clinical decision support rules in the system, and again, we'll take care of that for you. And then tab number 2, it's basically throwing in there another old objective from stage 1. It's basically throwing in there that RX interaction objective. And again, just like that RX hub that was kind of combined with ePrescribe that I described a second ago, the RX interaction objective, again, those are just company settings that we should automatically have turned on for you, and those will remain on for the entire duration of your reporting period. So there's nothing special that you'll need to do to meet tab 2 or component 2 of decision support. Since those company settings are already going to be turned on, you should meet this no problem at all. And then again on tab 1, really, there's nothing special you need to worry about as well, because we're actually going to take care of setting up those 5 decision support rules for you. So here on decision support, this kind of like in stage 1, there's a couple freebies out there. This is kind of one of those freebies where there's not really much effort or things you need to do to meet this particular objective. A lot of this will be taken care of for you automatically. Okay. So we'll go ahead and close out of that. The next objective we'll take a look at here is patient education. So the patient education objective is basically the exact same as it was for stage 1. Okay, so basically for 10% of the patients you see during the reporting period, you need to make sure you've dispensed out of our system a patient educational document of some sort. Okay, one thing that is different about the objective is that for our stage 1, the patient education was a menu set item, so this was optional. For stage 2, they've moved this to the core set, so you have to basically be dispensing out at least, dispensing out patient education documents for at least 10% of the patients you see during your EHR reporting period. Okay, so we'll go ahead and close out of that. The next objective we have here is the CPOE objective. Okay, so we'll go ahead and click on CPOE to bring up this window. And the first thing I'm going to point out to you is that for CPOE, kind of like we saw there on decision support where we had multiple components that made up the one measure, same thing applies here for CPOE. So here in CPOE in the upper left-hand corner, you can see we've basically got 3 different tabs there that all need to be met for you to meet this one CPOE measure. Okay. So the way this basically works is basically tab 1 has to deal with your prescription orders. Okay. So the way it works is that for basically 60% of all of your, at least 60% of all of your prescription orders need to be generated electronically. Okay. Fortunately for you, OfficeEMR does not have the ability to track prescription orders placed outside of our software. So what that basically means for you is that for every e-prescription that you write, that prescription, electronic prescription order is going to fall into not only the denominator, but also the numerator. So essentially what's going to happen is you're always going to be at 100% here for not only tab 1, but also tabs 2 and 3 as well, and I'll kind of explain those in just a second. Okay. So here on tab 1, basically as long as you're kind of e-prescribing, you're going to meet this objective, because for every e-prescription you write, you're going to get a 1 in the denominator and the numerator, so you'll always be at 100%. Tab number 2 has to deal with your radiology orders. So the way this works is in our system, when you're on that order entry chart tab, if you go in and you place like an X-ray or a CT scan or any other radiology orders, every time you do that, that order, again, just like for your medication orders, your radiology orders, you're going to get 1 in the denominator, 1 in the numerator. So here you're always going to have 100%, even though the goal is only for 30%. So as long as you're creating orders for X-rays and CT scans and our other radiology type orders out of our system, you should meet this objective or this component of the CPOE objective, no problem. Okay. And then the third tab has to deal with your laboratory orders. So the same sort of concept we had for tabs 1 and 2. So here for your tab 3, as long as you are placing your lab orders in our system for your patients that you see, each lab order you place is going to fall into the numerator and denominator. So you're always going to be at 100% on your lab orders as well, so long as you're actually placing those lab orders in OfficeEMR. Okay. So the CPOE objective, even though there are kind of 3 components, it seems like it's a lot of work initially. As long as you're basically, the rule of thumb is as long as you're placing your lab orders, your radiology orders, and your e-prescribing in our system, you should meet the CPOE objective no problem. Okay. And then finally, the last objective we'll look at there in the sort of diagnose and treat component or section of the core objectives is your lab results objective. So we'll go ahead and click on that to pull this up. So what this basically means, and please make note that this is a core objective, so you must meet this, unless you, of course, meet the exclusion. Basically, what this is stating is that for 55% of all lab orders that you place for your patients, 55% or greater than that of those lab orders need to have associated electronic results that are tied to those. Okay? So one thing you'll want to basically make note of here is basically in order to kind of meet this objective, you're going to need to have a lab interface set up in your database there. So if you've got an interface already set up with LabCorp or Quest or one of the other labs that we already have a kind of an action or an interface set up with, you should be good to go here. If you are testing for stage 2 and you do not have a lab interface set up, it is important to note that you'll want to basically reach out to the iSalus Healthcare support team, let them know that you're trying to attest for stage 2 and that you need to set up a lab interface as quickly as possible so that you can meet this objective and in turn be able to attest for stage 2 meaningful use for year 1 of that. Okay. So that is your lab results objective. The next objective we'll then get into is the clinical summary objective. So the clinical summary, as you can remember, this is one that you had for stage 1. So this is that clinical summary that you would print off and either give to the patient or kind of discard there at checkout when you're checking the patient out in the iScheduler. So this objective is basically the exact same. So the threshold of 50%. So for at least 50% of the patients you see during the reporting period, you need to give the patient the clinical summary. Okay. The one thing that has changed, and you'll want to make note of this, is before for stage 1, you had up to 3 business days within the patient's actual appointment or from the patient's actual appointment to actually provide that clinical summary to the patient. For stage 2, they have basically narrowed down that time frame to 1 business day of the patient's office visit. So you have either the ability to kind of print off the clinical summary on the day the patient was seen or the day thereafter, or you're going to miss out on that patient meeting this particular objective. Okay. One other thing you may note or kind of notice is when you start printing off these clinical summaries, the content contained within the clinical summary is actually changed as well. There's actually quite a bit more information. So you'll absolutely see that when you print off your first couple of clinical summaries. No longer are they kind of 1 or 2 pages. They'll probably be several pages of different clinical information that CMS has kind of determined every patient should be able to kind of quickly and easily have access to and should be provided on this clinical summary document. So that is another thing that will change as well in terms of the content that is contained within the clinical summary. The next objective you see there is the patient reminders objective. So I'll go ahead and click on this button to pull up this window. So this basically is still the exact same as it was pretty much for stage 1. Obviously the biggest difference being that this patient reminders objective has moved from the menu to the core set. So the patient reminders objective is now a required objective that you must meet. And basically all it is that for at least 10% of the patients you see during the reporting period, at least 10% of those patients were provided an appropriate reminder about their appointment. Okay. One other thing, a couple other things that have changed with this objective has to deal with the kind of wording and who actually qualifies. Basically, it works like this. So if a patient was seen for 2 or more visits during the 24-month period directly prior to the beginning of your 2014 reporting period, for those patients, they will fall into the denominator for this objective. And then for 10% of that kind of group of patients, you'll need to send them an appropriate appointment reminder out of our system. Okay? The way you'll generate the reminder has not changed. That's still the exact same. You'll basically go to the iReports section of the application here within Reports, and you'll basically search for those patients, and then you'll be able to generate the appropriate reminder letter and print that off very quickly for all of those patients and get those sent out. And just like we've kind of seen now for a couple of other objectives, here for the timely access, you'll want to pay attention to the upper left-hand corner where you've got tab number 1 and tab number 2. So here for timely access, you sort of have two separate components that both must be met in order to kind of meet timely access as a whole. Okay? So for tab 1, the objective is pretty similar to how it was for stage 1 of meaningful use, where you basically have to kind of grant or create what's called a patient portal, or in our case, a My Medical Locker account for the patient. Okay? One thing that is different here on this part of the objective, or for tab 1, is basically the number of patients you need to do that for. So in stage 1, you just had to grant that timely access by creating a My Medical Locker account for at least 10% of the patients you saw during the reporting period. For stage 2, they've upped that now to 50%. So for 50% of the patients you see during your reporting period, you need to make sure that you're basically doing the proper steps to get them set up with a My Medical Locker account. Okay? Now, the way it works in our system now, we've actually kind of rolled out a new patient portal, and the way it's going to work from here on out is the patient is going to have to go out and sort of create their own account. You won't have to do it for them anymore by capturing that email address or anything like that. The patient is going to, basically the onus is going to be kind of put on the patient now to go out and create that account. And then once that's done, that patient will then fall into the not only denominator but also the numerator as well, successfully setting up their My Medical Locker account. So the way it'll basically work on our system now is kind of when you go to check the patient out in the iScheduler, you mark them as checked out, you get your quick pay window that pops up. In the same spot where you go to print off the clinical summary, we now are also going to automatically queue up an additional document for you to print out for the patient, and that's going to be a My Medical Locker account setup letter. Okay? So what you want to make sure you're doing for at least 50% of your patients, I imagine you probably just make sure that, while you're doing the clinical summary objective, go ahead and do this timely access one too, since you're right there. Go ahead and print off this My Medical Locker account setup letter for the patient as well. The letter is going to have detailed instructions that's going to literally walk the patient through step by step where they need to go to create a My Medical Locker account. And then once the patient has done that, they will essentially be set up and fully meeting part 1 or tab 1 of this objective. Okay? So part 1 is basically the patient going out there and actually creating that My Medical Locker account, or bare minimum printing out the letter for them so that they know how to do that. Okay? So printing the letter, that action alone will actually get them the count for this objective. They don't actually have to create the account, but so long as you've actually printed off that letter, that's good enough for part 1. Okay? For tab number 2 of timely access, we take it a step further. Okay? So for tab 2, what this portion of the objective is stating is that for at least 5% of the patients who've gone out there and they've created a My Medical Locker account, for at least 5% of those patients now, you need to make sure that they go in there and they actually either view, download, or transmit to a third party their ambulatory summary. Okay? Ambulatory summary, that's just a fancy word for that clinical summary, essentially. It's the same document. Okay, so you just need to make sure that at least 5% of those patients who are going out there and creating My Medical Locker account, you need to make sure that they actually log in and then view their clinical summary from within the patient portal. Okay? Now, I know I'm not going to kind of walk through that here now in the training video, but just so you know, built into iSalus, or built into the OfficeEMR, I should say, here in the upper right-hand corner, you have that OfficeEMR search box. And for timely access, so for this particular objective and all of the objectives for stage 2, you'll be able to just search for timely access or whatever objective you want more information on, or you want to pull up the quick use guide for. You'd be able to search for that, okay, through the OfficeEMR search. And then on your left-hand side in the upper left-hand corner, click on quick use guides, and you basically would see the timely access quick use guide. You'd be able to pull it up, and at that point, it'll walk you through step by step how to actually print off and create that letter for the patient so that they can go out and create that account, and then it'll walk you through step by step how the patient, once they're actually in their patient portal account, how they'll be able to go about actually pulling or viewing or downloading or transmitting to a third party that clinical. Through the patient list objective, the only thing that's changed for this measure is that it has moved from the menu set up to your core set of measures, so you have to meet this objective. Otherwise, it's the same exact thing as it was before. So all you'll need to do for the patient list objective is just make sure you run at least one disease management report out of the reports section of the application. So we're actually within reports right now, so again, that disease management report is just over here on the right-hand side. You want to click on disease management underneath the meaningful use heading, and then basically go out there and perform a search for a certain segment of your patient population. So again, I saw you search for all your diabetic patients or all your hypertensive patients. That's all you need to do. It's just a one-time report you need to run at some point during the EHR reporting period. And once you run that report, you'll meet this particular objective. Okay, so that's patient list. The next objective we'll take a look at there is secure messaging. That a little bit here real quick. So I'll click on the secure messaging button. So the way this works, this is kind of tied in a little bit to that timely access objective we just spoke about there. So the secure messaging, this is a task or function that actually has to be completed by the patient. So what the patients will want to do is so at least 5% of the patients who have basically created that My Medical Locker account, or I guess at least 5% of patients you've seen during the EHR reporting period, you need to make sure at least 5% of those patients are going into their My Medical Locker account, and they're sending you, the eligible provider, a direct secure message. Okay, so there are, again, as I mentioned, there should be a quick use guide out there in the OfficeEMR knowledge base that will walk you through step by step how the patient will get logged into their patient portal account and then send that secure message, but that's essentially what needs to be done here to meet this objective. The patient just needs to send at least one secure message through the patient portal to you into your database through the OfficeEMR platform. Okay. And once that's done and you're making that happen for at least 5% of the patients you see during the reporting period, you'll be good to go on this particular objective. The next objective we'll take a look at is summary there. To pull up this, so this is another one of those objectives that has 3 components, so you want to pay attention to your 3 tabs there in the upper left-hand corner of this objective window. And again, all 3 of those tabs need to be met in order for you to kind of meet the summary care objective as a whole. So here on tab 1, what that particular piece of the objective is basically stating is that for more than 50% of patients who are referred to another provider or transition to another setting of care, they need to have a summary of care document sent electronically via a direct email. Okay, so direct email is a new concept that CMS has introduced here for stage 2 of meaningful use. It's essentially a secure messaging platform for providers to quickly and securely share patient information electronically over the internet. Okay, so the direct email, in order to kind of send those direct emails, you'll have to have a direct email address set up. And iSalus Healthcare will actually take care of setting that up for you automatically. Where you'll need to go in the system to kind of locate that direct email address and see exactly what it is you'll basically just want to go into the provider setup window for yourself, and you'll see it directly within that screen there with the rest of your sort of NPI number, DEA number, and information. So that's where you'd find your direct email address. Again, we'll take care of setting that up for you, but that's where you'd want to look in the provider setup window to kind of locate what that address happens to be. Okay, so that's tab 1. Tab 2, what that is basically stating is that for more than 10% of all referral orders that have been placed in the system, those also need to have a summary of care document sent along with those orders, and that summary of care document, again, needs to be sent electronically using that direct email. Okay? And then tab number 3, what this particular piece of the application is stating is that at least one test of sending a summary of care document electronically to a direct email address outside of the iSalus direct certificate needs to take place. So essentially what that means is that if at some point on tab 1 or tab 2 you actually send a direct email containing that summary of care document to an actual provider other than yourself, you will in turn meet tab 3. Okay? So those are your 3 tabs there for summary of care. Again, all 3 of those need to be met in order for you to kind of meet the entire summary care objective as a whole. Okay. And then last but not least there on the core objectives, actually it looks like we have a couple more there that we need to touch on. Actually, sorry, no, it is the last one there. So the Immunization Registry. What this objective is basically stating is it's the same exact one as it was for for stage 1, where you need to electronically export that immunization file and then upload it to your state's immunization registry. Okay? So the way this will basically work is for stage 1, what you had to do is you just needed to perform one successful test to ensure that your certified EHR was capable of exporting the proper HL7 immunization file out of the system so that you could send that to your state immunization registry. For stage 2, we're taking it a step further. So not only you're no longer testing it, you're actually kind of putting this into real practical use. So what you need to do for the immunization registry is you basically need to export out of our system all of the immunization data you have for the entire EHR reporting period. Okay, and to state that a little bit more simply, what that basically means is you have the ability to choose whether you want to kind of export this data just like on a weekly basis throughout the entire 90-day period. You can do it like that. So you can export it daily, weekly, monthly, however you want to do it. You just need to make sure you're doing it frequently so that at the end of the 90-day period, you've exported all the immunizations that were captured during those 90 days. So you can do it frequently, weekly, daily, however you want to do it. Or even if you wanted to just kind of wait until the very end of the 90-day period and export a big file at the very end containing everything, you could do it that way as well. Okay, so whatever way you want to do it, it's perfectly fine. It's up to you. You need to actually just make sure you are exporting that immunization information out of our system, though, and then uploading or providing that to your state immunization registry. Okay. And that is all of your core objectives now for stage 2 of meaningful use. So the first objective we'll take a look at here is an objective called electronic notes. So this is actually a brand new objective for stage 2, and it should be pretty easy for a lot of you. So all this objective is basically stating is that for 30% of all of the notes that you create for your office visits during the EHR reporting period, at least 30% of those need to be saved and signed off electronically. Okay? So the reason I said this should be pretty easy for a lot of you is because if you are actually fully using our system and going to that SOAP Notes chart tab to populate, complete, and then sign off electronically the notes for all of your visits, you should meet this objective no problem. Okay? For those of you who may be kind of not using it quite fully, just make sure that you are electronically saving and signing off on at least 30% of the notes you're generating throughout the EHR reporting period so that you're meeting this particular objective. Okay. The next objective we have there is family health history. So this is another brand new objective for stage 2 of meaningful use. And what this objective basically states is that for more than 20% of the patients that you see during your reporting period, at least 20% of those patients need to have at least one saved template item on their history template in the EMR that has been codified to SNOMED as a family history subtype. Okay? So I know there's kind of a lot of verbiage going on there that I just said there. Essentially what's going to happen is we at iSalus Healthcare, we're going to automatically go into your history template in the history chart tab in the EMR, and we're going to automatically codify your family health history to SNOMED for you automatically. So there's nothing special you need to do besides just making sure that you are capturing at least one piece of sort of family health history information for at least 20% of the patients you see. Okay, so we'll kind of take care of the legwork behind the scenes of getting everything codified. All you need to do is just make sure you go into that family health history section of your history and make sure you capture at least one piece of family history information for, again, at least 20% of the patients you see during the reporting period. So that one should be another pretty easy one for you guys to meet as well. The next objective we have there is called imaging results. So if I go ahead and click on that and pull up the window for this. So basically what this essentially means for the imaging results is that for at least 10% of your radiology orders that you place and generate out of OfficeEMR, at least 10% of those patients need to have a corresponding, should be like a results document that has been scanned into e-documents into the patient's chart and then in turn linked to that actual order. Okay, so if you need a refresher on how to actually scan anything into a patient's chart and then how to link a document to a checkbox for a particular radiology order, again, there's going to be a quick use guide out there in the OfficeEMR search knowledge base that'll walk you through step by step how to do that. But again, this should be a pretty easy one for you to meet. Again, it's just 10% of all of your radiology orders. You basically just need to scan in an electronic result that has come in, or sorry, scan in a paper result that has come back in for that radiology order, scan it into the patient's chart, and then link it back to that order. And again, there's quick use guides out there in the system that'll walk you through step by step how to do that. Surveillance, okay? And again, if you kind of remember here in the menu set, you only have to meet 3 of the 4 objectives. What I'm probably thinking, or would bet good money on, is that for the most part, a lot of you are just going to actually meet these first 3 menu set objectives that we just walked you through, so electronic notes, family health history, and imaging results. You probably, I would bet you're going to go after those 3 objectives on the menu set to meet your 3 out of 4, just because for the syndromic surveillance objective, it was really, this objective is really kind of fit for only those practices where you were focusing on emergency medicine, okay? So what the syndromic surveillance objective is basically stating is that providers must export all syndromic surveillance data for an entire EHR reporting period and then submit that data to a public health agency in their area. Okay? Again, this is typically only used by emergency care clinics. Okay? If this description sort of fits you, and you want to set this up and attempt to go after this objective for meaningful use, what you want to do is just contact the iSalus Healthcare support team, let them know you want to go after that syndromic surveillance objective for stage 2 of meaningful use, and then we'll work with you at that point to get the necessary things set up in our system and then actually show you how to do that. Okay? Since this basically the situation isn't going to fit for a lot of our providers, I'm not going to take the time to kind of walk you through or explain it in any greater detail, but again, based on my kind of brief description here, if you think this fits you and your practice and what you do, and you want to get this set up, just quickly reach out to the iSalus Healthcare support team, and we'd be more than happy to walk you through getting this set up and walking you through what you need to do to actually meet this objective. Okay? So that is the very last objective that we have there on the menu list. For stage 2 of meaningful use, and that's actually the last objective we actually have on the entire dashboard now for stage 2 of meaningful use. Okay, so again, today was just kind of meant as a brief overview and introductory lesson into stage 2 of meaningful use. Again, if you have any further questions or want to kind of dive a little bit deeper into these objectives and you're not sure how to use them, again, you're going to be able to perform an OfficeEMR search here in the upper right-hand corner. You'd be able to just search for the name of the objective you see on any of these buttons on the dashboard. Just type that name here in the upper right-hand corner to search for the quick use guide that belongs to that particular objective, And when you pull up that quick use guide at that point, it'll literally walk you through step by step how you in OfficeEMR meet that objective for the correct percentage of patients you need to do that for. Okay. Any questions outside of that? Again, you'd also be able to contact the iSalus Healthcare Support Team via the support@isalushealthcare.com website, or through our phone numbers, or direct messaging through a communication within your database as well. Okay. And with that, I will wish you all a great day and good luck on stage 2 of Meaningful Use.